Preparation of bone marrow smears. Bone marrow is composed of reticulum cells and reticulum fibers, blood cells and nerves, hemopoietic cells and their mature stages, fat cells. Before deciding to examine the bone marrow, one should observe something abnormal in peripheral blood smear. The bone marrow biopsy can be obtained by following three methods: needle aspiration, micro trypin biopsy, surgery biopsy. Needle aspiration, it is a simple, safe and relatively painless method and performed by using the special design needles such as a shal and Klima. The disadvantage of this technique is some marrow cells may be destroyed. Micro trypin biopsy. This method is not very simple but can performed in OPD outpatient department by using the needle such as a JCD's swim or Yeslam. This method does not give more than 0.3 ml of fluid at a time. Surgical biopsy. This method is carried out under aseptic condition in operation theater. The disadvantages of this method are it is difficult to repeat and it does not advise in patient with leukemia and bleeding disorder. Site of biopsy: the sternum, iliac chest, anterior and posterior iliac spine, upper end of tibia in children below 2 years. The aspirated material tends to clot rapidly, therefore the smear should be made immediately after aspiration of bone marrow. Preparation of a bone marrow film. The bone marrow films are made from bone marrow aspirate. The marrow contaminated with blood is not suitable for microscopic examination, therefore blood is removed from the aspirate before preparation of the film. It is sucked with a needle or chalice pipette. The yellowish irregular shaped fragments are used to prepare smear. Place a drop of bone marrow aspirate or on microscope slide. Bone marrow aspirate may contain some granular particles. These particles can be crushed with the help of another slide. Place another slide over the first slide with bone marrow fluid, but slight pressure on the second slide to crush the particle. Now separate the slide with the help of spreader. Prepare bone marrow smear. The smear should be about 3 to 4 centimeter length or and 1 to 1.5 centimeter diameter. At a time, about 3 smear should be prepared. Air dry the film and stain with any stain used for peripheral blood smear like Gimsa, Leishman or right stain. Bone marrow smear should be examined in tail region. They start with 10x to 40x to 100x. Now makes differential count of large number of cells, 32,000, and calculate the percentage of each type of cells. Normally the cellularity of bone marrow varies with the age. It is more in infant and less in adult. In bone marrow examination, first of all observe the erythropoietic cells, then look for maturity of leukopoietic cells. The cell appears as a dark blue masses and fats as round vacuoles. Normal aspiration contains about 40% of fat cells and 60% of marrow cells. In hypercellular aspiration, the fat is reduced, and in hypocellular aspiration, fat is increased. It is increased to note the following stages of erythropoiesis: activity of erythropoietic cells and ratio of myeloid erythroid cell, that is ME ratio. In normal adult, the ME ratio is 3:4. The ME ratio at birth is 85:1. During the first week it is 11:1 and gradually increases to 3:1. Look for number and maturity of developing granulocyte. Look for abnormal cells and toxic granules. Look for any abnormalities in the lymphocytes. The megakaryocytes and megakaryocytes and the morphology of differential cells also observed for parasites and bacteria. Clinical significance: the microscopic examination of bone marrow smear is useful for diagnosis of several hematologic disorders such as acute leukemia, iron deficiency anemia, and secondary deposit in bone marrow, aplastic anemia, thrombocytopenia, disease of reticuloendothelial system, and much other blood related disorder. The ME ratio indicates the activity of bone marrow. The ME ratio rises in leukemia and falls with leukopoiesis.